Hello everyone and welcome to our channel Homeopathy World. I am Dr. Samina and in this video we are going to discuss the FMT, that is Forensic Medicine and Toxicology MCQs. These videos are specially made for students who are aspiring to give their PG entrance exam. So this will be a complete series on all the MCQs of all the subjects. So if you want to visit this particular playlist, go to my playlist and then go to MCQs. And you will find that all the MCQs of each subject are given in serial order. Like the Forensic Medicine MCQs today will be numbered as 1 to 50 and the next video will be given as 51 to 100. Okay. So without wasting further time, let's get started with the first MCQ. That is, the xiphoid process unites with the body of the sternum at the age of A. 60 years, B. 40 years, C. 25 years and D. 16 years. So the answer is 40 years. Next question is, where does rigor mortis start from? A. Heart, B. Kidneys, C. Stomach and D. Eyes. So it starts from the heart, the most vital organ. So we should not forget that rigor mortis occurs in 3 stages. The first stage is primary relaxation or flaccidity. Second stage is rigor mortis or cadaveric rigidity, and the third stage is secondary flaccidity. We all know that rigor mortis is the state of stiffening of the muscles, sometimes with slight shortening of the fibers, that occurs after death, and the muscles of the body are affected are voluntary as well as involuntary. Moving on to the next MCQ. Which of the following are used for detection of seminal stains? First is Takayama's test, second is Barberio's test, third is Florence test, and fourth is acid phosphatase test. Now here the correct answer is a combination of 3 answers. So you have to answer whether it is A 1, 2 and 3, B 2, 3 and 4, C 1, 3 and 4 and D 1, 2 and 4. So let's see the answer. The Takayama test is to identify the blood stain, that means it is wrong. Barberio's test is to identify the spermatic fluid. Florence test is to identify the semen present dark brown crystals, and acid phosphatase test is again to identify the seminal fluid. So we can say that the correct answer is 2nd, 3rd and 4th. So the correct option here will be D, 2nd, 3rd and 4th. Moving on to the next question. Of the below, which is the minimum age of a girl who can give ID consent in writing in the presence of one witness for medical examination in case of rape or kidnapping? So what is the minimum age of the girl who can consent in writing for medical examination in case of rape or kidnapping? A girl of age 14 years, a girl of age 13 years, a girl of age 12 years, or a girl of age 15 years. So the answer is a girl of age 12 years. The next question is, the most reliable diagnostic sign of drowning is A. Foreign body in air passages, B. Water in stomach, C. Cutis enserine, and D is froth at nostril. So most of you might think the water in the stomach is the answer, but no, the answer is froth at nostrils. Okay. The next question is, ossification center appearing just before birth is A. Upper end of humerus, B. Lower end of tibia, C. Lower end of femur and D. Scaphoid. The answer is lower end of femur. The most reliable method of identification of a person is A. DNA analysis, B. Fingerprinting, C. Scar and D. Anthropometry. Again, the most common mistake here that we do is we mention fingerprint as we have read dactylography, but no, the correct answer is DNA analysis because this is the most reliable and most unique method of identification of a person. Okay. The time required for fixation of postmortem stainings fall within one of the following ranges. A. 1 to 4 hours, B. 4 to 6 hours, C. 6 to 12 hours and D. 12 to 18 hours. The answer is 6 to 12 hours. The next question is, the most common type of inquest in India is. Now, without even blinking, you should answer this question, but let's see the choices. A. Coroner. B. Magistrate. C. Procurator Fiscal. And D. Police. So the answer is police. The most common type of inquest in India. Okay. Next question is, one of the following statements is not true. So when the question arises that one of the following statements is not true, you have to see that what are the true statements here. And then we can judge what are the false statements. So let's see what are the statements. An additional sessions judge can award any punishment authorized by law. Now this is a true statement. An assistant session judge can award imprisonment for a term exceeding 10 years. So more than 10 years. Now I am doubtful about this answer. So let's consider we don't know that. The next is, death sentence passed by an additional sessions judge has to be confirmed by the High Court. Yes. So the Sessions Court cannot give a death sentence. It has to be verified by the High Court. And next is, an assistant session judge cannot pass a death sentence. That is what we said in C. So that is also correct. So these are all true. So what is not true? So obviously the answer will be, an assistant session judge can award imprisonment exceeding 10 years. So they cannot give an imprisonment that is exceeding 10 years. Next question, which of the following produces both physical and psychological dependence? A. Cocaine, B. LSD, C. Opium, and D. Marijuana. Here the answer is C. Opium, because it produces both physical and psychological dependence. Rest others are producing only psychological dependence. From these, only opium is the one which is producing both psychological as well as physical dependence. So that is why opium is the answer. Next question. Foramen ovale in an infant gets closed in one of the following periods after birth. A. 12 weeks, B. 24 weeks, C. 12 months, and D. 23 months. The answer is D. 23 months. Next question is, in court proceedings, the judge can ask questions during A. Examination in chief, B. Cross-examination, C. At any stage of examination, and D. Re-examination. So the answer is at any stage of examination. The Central Council of Homeopathy Act was passed in the year 1971, 1972, 1973 and 1974. Now it has no option. You have to remember it is 1973 on 19th December. Okay. Now, which of the following beverages contain the maximum percentage of alcohol? A. Whiskey, B. Brandy, C. Wine, and D. Rum. So the answer is D. Rum. Rum contains about 60%, 50 to 60%, while whiskey, gin and brandy contains 40 to 45%. Port or sherry wine consists of 20% of alcohol. Wine contains of 10 to 15% of alcohol, and beer contains of 4 to 8% of alcohol. Next question. The venom of crate is A. myotoxic, B. cardiotoxic, C. hemotoxic, and D. neurotoxic. So the answer is neurotoxic. Obviously, most of the venoms are neurotoxic. Next question. Touting means using agents for procuring patients, B. splitting of fees received for professional service, C. assisting unqualified persons in treating patients, and D is association of a doctor with a body of unqualified persons. So the answer is A. Touting means using agents for procuring patients. Fee splitting received for professional service is known as dichotomy. Moving on, one of the following is not a delayed cause of death from injury. A. Tetanus, B. Fat embolism, C. Thromboembolism, and D. Air embolism. So the answer is basically none of the above, as all of these are the remote causes of death and none of it is delayed cause of death. Yet if you have to mention something, then you should mark tetanus. Okay. Next question. Avulsion is a type of A. chop wound, B. incise wound, C. lacerated wound, and D. none of the above. So the answer is lacerated wound or laceration. Okay. Avulsion is laceration produced by sufficient force, that is shearing force, delivered at an acute angle to detach a portion of traumatized surface from its attachment. So this is nothing but definition of avulsion. Let's move on. The next question is, in judicial hanging, fracture of vertebral column is usually seen between A. C1 and C2, B. C2 and C3, C. C4 and C5, and D. C5 and C6. The answer is C2 and C3. Here they are talking about the judicial hanging, okay, not other hangings. Next is, medullary index of hair is used to determine A. age, B. race, C. sex, and D. species. So the answer is D. species. Next question. Which of the following biological fluids is not studied for estimating postmortem interval? A. vitreous humor, B. urine, C. CSF, and D. blood. So the answer is urine is not studied for estimating postmortem interval. Next question. Fingerprints can be permanently altered by A. eczema, B. leprosy, C. psoriasis, and D. scleroderma. The answer is B. leprosy. In leprosy, the fingerprints can be permanently altered. Few more reasons that can cause impairment of the fingerprint pattern is, along with leprosy, electric injury and exposure to radiation. Next question. Brush burn results from A. impact, B. graze, C. pressure, and D. dry heat. The answer is graze. Graze is sliding, scraping, or grinding abrasion. These are the commonest type of abrasions. Okay. Next question is, haptic hallucinations are seen in chronic poisoning with A. cocaine, B. cannabis, C. LSD, and D. heroin. The answer is cocaine. Haptic hallucinations are sensations of being touched or strangled, feeling that insects are crawling beneath the skin, or feeling of sexual stimulation. That is known as haptic hallucinations. Poisoning with one of the following produces clinical features similar to viper bite. The answer is A. Abrus precatorius, B. Ricinus communis, C. Semicarpus anacardium, and D. Cerebra thivitia. The answer is A. Abrus precatorius, shows clinical features similar to viper bite. Next question. The first class judicial magistrate can award imprisonment for maximum period of A. 3 years, B. 5 years, C. 7 years, and D. 10 years. So the answer is 3 years. Not more than 3 years. That is a first class judicial magistrate. Now, if there is a chief judicial magistrate, he can give up to 7 years. And first class can give up to 3 years. And second class judicial magistrate can give up to 1 year. Okay. These are the things that are important. Okay. Next, a fetus is considered viable during the following month of uterine life. A. 5th month, B. 6th month, C. 7th month, and D. 8th month. The answer is 7th month. That is when the child is born at or after 210 days of intrauterine life are viable. Next question. The section of IPC that define an injury. A. 44, B. 319, C. 320, and D. 324. So the answer is 44. That is A. An injury is an harm or whatever illegally caused to any person in the body, mind, reputation, or property. Next question. The usual postmortem interval required for the appearance of marbling is A 18 hours, B 24 hours, C 36 hours, and D 48 hours. The answer is 36 hours. Next question. Homicidal hanging is also known as A. Mugging, B. Lynching, C. Garroting, or D. Burking. The answer is B. Lynching. So let's see what are the other different terms that are given here. Mugging is strangulation caused by holding neck of the victim in the bend of elbow joint. Lynching is homicidal hanging. Sometimes a suspect, accused, or enemy is hanged by a rope from a tree by the mob. That is known as lynching. Garroting is the victim is attacked from behind without warning. That is known as garroting. And burking is method of homicidal smothering and traumatic asphyxia. So you should know all these terms so that you know which one is correct from the above. Okay. Moving on. Minimata disease is seen in poisoning with A. Copper, B. Lead, C. Mercury, and D. Antimony. The answer is C. Mercury. Next question. McEwan's pupil is seen in poisoning with A. Ethyl alcohol, B. Opium, C. Barbiturate, and D. Chloral hydrate. Answer is ethyl alcohol. So we all know there are three stages of alcohol intoxication. Stage of excitement, stage of incoordination, and stage of coma. These three stages are very important for you to remember. Okay. Next question. Accusable homicide includes A. Judicial execution, B. Homicide committed by an insane person, C. Infanticide by murder, and D. Death following police firing. So the answer is homicide committed by an insane person. Next question. The clinical features of lucid interval is commonly seen in one of the following types of intracranial hemorrhage. A. Subdural, B. Extradural, C. Intracerebral, and D. Subarachnoid. The answer is extradural. The next question. The most common type of fingerprint pattern is, now everybody knows this, then too we'll go through the choices. A. Loops, B. Whorls, C. Arches, and D. Composite. We all know that the answer is loops. So loops are commonest as it is 67%, whorls 25%, arches 6 to 7%, and composite is 1 to 2%. The blood is cherry red color in the poisoning of A. Nitrites, B. Cyanide, C. Carbon monoxide, and D. Phosphorus. The answer is carbon monoxide. So what are the different colors? As mentioned, in carbon monoxide poisoning, it is cherry red. Okay, the answer is hydrocyanic acid will show bright red color. Poisoning by nitrites, potassium chloride, and potassium bicarbonate and aniline will be red brown, and phosphorus will be dark brown. Okay, so nitrites will be red brown, cyanides will be bright red, carbon monoxide will be cherry red, and phosphorus will be dark brown. So moving on to the next question. The most reliable criteria in Gustafson's technique for age determination is A. Attrition, B. Cementum apposition, C. Root resorption, and D. Root transparency. The answer is D. Root transparency. Delirium tremens is seen in chronic abuse of A. Alcohol, B. Cocaine, C. Datura, and D. Heroin. Answer is alcohol. So next question, question number 40. Compressing the neck by the bend of the elbow is, now just now we mentioned this thing in the answers, A. Mugging, B. Barnstola, C. Burking, and D. Choking. So the answer is mugging. Mugging means compressing the neck by the bend of an elbow. Okay. So mugging is strangulation caused by holding the neck of the victim in the bend of the elbow joint. Banstola is one strong bamboo or stick is placed across the back of the neck and other across the front. Burking is method of homicidal smothering and traumatic asphyxia. So these things should be remembered so that we know what is the correct answer. Okay. The next question number 41 is, the commonest site of traumatic rupture of intestines is A. jejunum, C. duodenum, and D. cecum. The answer is A. jejunum. Next question. One of the following skeletal indices is used to determine the race of an individual. Answer is A. Ischiopubic, B. Sciatic notch, C. Cephalic, and D. Medullary. The answer is C. Cephalic. All of the following injuries amount to grievous hurt except. Now, what is a grievous hurt? Now, we know that grievous hurt constitutes emasculation, permanent privation of sight of one eye, permanent privation of hearing of either ear, permanent privation of any member of joint, destruction of permanent impairing of power of any member of joint, permanent disfigurement of the head or face, fracture or dislocation of the bone or tooth, or any hurt that endangers the life. So, we have to know this criteria for grievous hurt to answer the question first. Okay, so the criteria is mentioned here. Now let's move back to the options. The options are A. Permanent privation of sight of either eye. That is correct. Okay, so this is correct. Privation of any member of joint. This is also correct. Disfiguration of head or face. This is correct. And fracture or dislocation of any bone or tooth. This is also correct. So which of this is correct except? So the answer here that is missing is, it is none of the above. None of the above is wrong. Sometimes the answers are mistaken or misprinted, and sometimes the MCQs are also wrong. So you don't have to worry about it. We'll just know what the correct answer is and we'll move on. Okay. The next question number 44 is, bluish discoloration of vaginal mucosa in pregnancy is known as A. Goodell's sign, B. Bame's sign, C. Hegar's sign, and D. JIPMER's sign. The answer is JIPMER's sign. So what is JIPMER's sign? The mucous membrane of the vagina changes from pink to violet as a result of increased vascularity, also known as Chadwick's sign. So here the answer could have been Chadwick's sign. Okay. Or if the answer is given like A. JIPMER's sign, B. Chadwick's sign, C. both, D. none of the above, then you have to write both because both the names are for the same thing. Okay. Now let's see what is Goodell's sign. Goodell's sign is from second month onwards there is softening of the cervix. That is known as Goodell's sign. Hegar's sign is from 6th week onwards, one hand placed on the abdomen and 2 fingers in the vagina. The firm hard cervix is felt and above it an elastic body of the uterus is felt. Okay. So that is Hegar's sign. Let's move on. The next question number 45 is, which one of the following is not an aggravated form of rape? So A. Gang rape is an aggravated form of rape. Yes. B. Rape on a pregnant woman is again an aggravated form of rape. Rape on a woman in police custody, aggravated form of rape. And D is not an aggravated because it's a normal rape that is seen, rape on a girl below 15 years of age. Next question number 46. Of the following causes of impotency in male, which is the commonest one? Now we should know what are the commonest signs of impotency in male. Okay. The answer is one of the options. A. Diabetes mellitus, B. Large hernias, C. Emotional disturbances, and D. Orchitis. Now you have to see that which is the commonest, means which occurs in most of the people. That is, emotional disturbance occurs in most of the people. So that is the answer. Next question. One of the following types of injury is characteristic of run-over accidents. A. Avulsion, B. Stretch lacerations, C. Patterned abrasions, and C. Split lacerations. So the answer is avulsion. Avulsion is common by run-over vehicle as they are dragged, and the impact injury is found similar to avulsion and compression injury. Okay. Next question. The most definite method of identification of individual is, again, we have been through this. The answer earlier we had seen as the most definite method of identification of an individual is DNA printing. Okay, but here you can see the answer is DNA fingerprinting, neutron activation analysis, cilioscopy, or dactylography. So the answer could be DNA fingerprinting or DNA typing. Okay, so this answer should have been DNA printing or DNA typing. But here the answer, because the DNA printing or typing is not given, the answer is given as dactylography. Okay, that might be wrong, but if you have DNA as an option, you should always mark DNA first. Okay. Question number 49. Hydrocution is due to A. Electrolyte imbalance, B. Vagal inhibition, C. Reflex laryngeal spasm, and D. Ventricular fibrillation. The answer is vagal inhibition. Next, or 50th question is, all the following are signs of brainstem death except A. Dilated and fixed pupils, B. Absence of pulse, C. Absence of vestibulo-ocular reflexes, and D. Absence of spontaneous breathing. The answer is absence of pulse indicates nothing. Okay. Rest all are the signs of brainstem death. So these were the first 50 MCQs. I'm going to stop here and we'll move to the next part of the video with forensic medicine and toxicology MCQs part 2, that is 51 to 100 MCQs. Thank you for watching this video, and if you like this concept, do watch more videos on my MCQs, and maybe this would help in your PG entrance exams. Thank you so much.